Now we're about to have a conversation concerning our health. Today we're going to be exploring a small but very powerful gland that plays a crucial role in our health, and that's the thyroid. So in the studio with us is Dr. Solomon Brookman, Resident General Surgeon at the Bank Hospital. Hello, sir. How are you? All right. I'm fine, thank you. You're welcome to Breakfast Daily.
Thank you.
All right, so we're going to be talking about the thyroid.
Yeah.
What is the thyroid?
So the thyroid gland is a very important gland in terms of physiology in the human body. It produces a hormone called the thyroxine, and this hormone is important for a lot of functions in the body. All organs in the body depend on this hormone. The rate at which the heart beats, the function of the brain, very important organs in the body all depend on this thyroxine, which is the hormone produced by the thyroid gland. It is located in the anterior part of the neck, in the front of the neck, just below the Adam's apple, as we all know.
Yeah, but women don't have Adam's apple. Do we have?
Yes, they do.
Everybody does.
Oh, wow, we do?
Yes. It's technically called the thyroid cartilage. And the upper part of the thyroid gland is attached to this cartilage. And as I said, it's got a very important function. And so diseases of the thyroid gland can be devastating to the human body. And so it needs to be put out there for people to know. And visit their hospitals anytime they see some of these symptoms. So they could be catch early, they could be caught early, and then remedies can be put in place to prevent them.
Right. So what are the most common thyroid disorders?
So thyroid disorders are varied. As I said, the gland produces a hormone, and so the disease condition depends on how much hormone the gland is producing. So in the group of the diseases, the gland is not producing enough of the hormone. In another group of the diseases, the gland is producing too much of the hormone. So in diseases that is not producing, I will say the patients are hypothyroid. And disease that is producing too much, we say the patients are hyperthyroid.
Hypo and hyper.
Hypo and hyper. And then there are situations also where there's enlargement of the gland. So many times you see, especially women, around with a swelling here in front of the neck.
Is it like is that the goiter?
That is the goiter.
Is it only women?
A lot of them are women, but it occurs in men as well.
So majority is women?
Yes. Usually young women in their reproductive age. Is because the gland is important for stress. Now when there is stress to the body, the gland is stimulated to produce more of its hormones. And especially in situations where iodine is not enough in the diet. Then the gland enlarges, trying to produce enough of the hormone to meet the body's demands. And so the gland enlarges, and that's what we call a goiter.
As a doctor, what's the first thing that brings your attention to the fact that maybe somebody may be having a thyroid issue? So
the most obvious thing is the swelling that you see in front of the neck. But patients will come with varied complaints. Sometimes they are depressed. They just behave like a depressed person because body activities slow down when thyroid hormones are not enough. And so we say they are hypothyroid. And then also when they are hyper, they are anxious, they sweat a lot, they may lose weight. They also easily agitated, and so that is hyperthyroidism. And then the one very important one is cancer of the thyroid gland. It also comes with the swelling, and this cancer can spread and affect other parts of the body.
So but there's one, there's one actually that affects the eye. Which one is it hypo or hyper?
Yes, so hyperthyroidism mostly affects the eye. We call it exophthalmos. The eye protrudes.
Your eye comes out.
Very obvious. It looks the person it gives an anxious look to the patient. And so if you look at what is on this image now, that is exophthalmos. The patient you can see the whole of the black of the eye.
Yeah.
And a big part of the white of the eye as well. This is classically a case of hyperthyroidism.
Okay.
Wow.
So what would you how would you typically test for it? So you've seen it. How would you confirm that this is actually what I'm suspecting?
So in order to make a diagnosis, a doctor always will have a conversation with the patient. So we take a history, ask about the onset of the disease, how the disease is going, and then we examine the patient, feel the gland. First and foremost, you notice it's enlarged, and then how it feels. And then the other thing is we use imaging, for example, to assess the size of the gland. We do blood tests to determine the function, how much hormone the gland is producing, whether it's hyper or hypo. All these are important. But there are other tests also that needs to be done, especially if the patient needs surgery. And we'll go into that when we come to thyroid surgery.
When you say imaging, are you referring to MRI, CAT scan?
So we use X-rays, or ultrasound scans, CT scans, and MRI. The common ones we use is the CT scan. The early stages we may use ultrasound to determine the size of the gland. And then when we want to go into surgery, we want to determine whether the gland is growing behind the sternum, for example. Then we use CT scan to determine the extent of growth behind the sternum.
For me, like, I think it was last 3 years, I actually had like a thyroid scare. I went to the hospital and I was putting on weight, and the doctor checked me, and then he was like, your neck. I'm like, what happened to my neck? And he was like, have you ever had any issues with your thyroid? I'm like, no. He touched it. So the minute he started looking so much, I was like, what's the problem? He said, you need to do a thyroid test. I'm like, what's that? And I had to start reading about it. I said, oh my God, this is scary. So I went to do the test and everything was normal. He said, oh, don't worry, sometimes, you can just be putting on weight, but we just needed to be sure that there is nothing wrong. But now let's talk about the treatment, say surgery. At what point does it reach to say, okay, you need to do surgery?
So various disease conditions at a point in the treatment may require surgery. First and foremost, I mentioned the enlarged gland, where the gland is huge, and when it becomes big like that, it may press on other important structures behind the thyroid. The trachea, which is the windpipe, can press on it and makes it difficult for the patient to breathe. The esophagus, which is we also call the gullet, where food passes to enter the stomach, giving the patient difficulty in swallowing. So when it's that large, then we need to remove it to prevent these complications. Sometimes those with hyperthyroidism, the gland is producing too much of the hormone, but medications are not enough to control the gland. And so
this is before and after surgery, right?
Yeah, this is before and after surgery. And this woman will be greatly relieved of all those symptoms. So it's important patients come to us early, and we have the capacity to help them. So people should not be afraid. There's a lot of scare, as you said, about thyroid surgery. One, because of where the organ is located, just at the throat, and it's a bit like cut throat.
I know, right?
So people are scared.
Literally cut throat.
Yes, people are scared in coming to hospital. But technology has really advanced, and surgery is very safe these days. So we encourage patients to come, and we have the capacity. At the Bank Hospital, we are highly equipped with a lot of facilities. In theater, we have all the monitoring equipment to make surgery safe. So people should not be scared at all coming for thyroid surgery.
So when you refer to the advancement of technology, are we talking zero potential risks?
So surgeries definitely will have risks, but thyroid surgery risks, they occur, but they are very rare. And we in the Bank Hospital, again, after thyroid surgery, you are kept in the HDU, also known as the high dependency unit, where we have a one-on-one nursing care So any little change in the patient's condition will be detected.
I see.
And then corrective measures put in place to prevent any of these complications. So it makes it very safe. The quality of care is great, and so people should not be afraid at all. But there are risks, yes.
So what type of surgeries are most common?
In the bank?
Yeah, for
thyroid surgery, yes. So thyroid surgery is also varied. And the commonest we do these days is to remove the whole gland, because when you have recurrence of the swelling, the surgery is difficult. Yes, it can come back. When part of the gland is left in place, it can grow back, and the second surgery is more difficult. It's fraught with complications, and so we try to remove the whole gland, and the patient is put on a single tablet a day to replace the hormones produced by the gland. And so they live their normal life basically afterwards.
So the quality of life is
essentially the same. The only change is a tablet a day that you need to take.
Okay, all right.
Typically, if somebody is going to go for thyroid surgery, I mean, I'm sure the people who are watching us right now who are wondering that this condition that they see on TV, maybe they have some. What would be the normal preparations that they should go through to prepare?
Yes. So after the diagnosis is made, we first want to know the function of the gland. If the gland is producing too much of the hormone, then the patient is placed on medication to control the levels of the hormone. The commonest we use in this environment is carbimazole, and most thyroid patients know carbimazole, especially those who have hyperthyroidism. And so the thyroid function is controlled. And after controlling the function, the patient will go through a few tests to make sure that the body is fit enough to withstand surgery. We do blood work. We examine the blood to make sure everything is fine. Your blood level is okay. Most people know HB these days. And then we will do some imaging tests, as I mentioned earlier. We do x-rays of the chest. We do liver function tests. We want to know your liver is optimal in function. Kidney function tests to make sure all these are okay. And then the thyroid is very close to a very important nerve which controls our voice. And so we want to make sure your voice is okay to start with before we go into surgery. So we let the ENT surgeon, healthcare is multidisciplinary. And so we send the patient to the ENT surgeon to also examine the vocal cords to make sure everything is okay. And then we also do some blood work. We look for blood to save in case the patient may need blood in surgery. And then the patient is given a date when all this is done for surgery.
Right.
On the day of surgery, patient is taken to theater, and then an anesthetist puts the patient to sleep. It takes about an hour and a half for this procedure in the hands of the experienced surgeon. It takes about an hour and a half. The patient is sent back to the recovery ward, and then from there to the high dependency unit. Where there will be very close
monitoring
care by nurses to make sure everything is
how
fine.
is the recovery process like, especially when it comes to time, and how long will it stay before you recover fully?
So after surgery, immediately after surgery, it takes up to 6 hours to recover fully from the anesthesia. And then at that point the patient can drink something if they want to drink, and then they'll be taken to the high dependency unit where they may stay for about 24 hours before they are moved to the main ward, the general ward, where also they get care, but not as intensive as in the high dependency unit. They are usually discharged a day or two after surgery, and they go back to work within 14 days to a month.
14 days to a month. Okay.
You can go back to work.
Okay.
All right. And you tend to find that most people post-surgery are okay. They don't have any complications or any reason to come back to the hospital.
Yes. Complications are rare. as I said, these days. And so most patients, second day post-op, they are walking about, they are eating.
Okay.
So we discharge them, and then they come for review in about a week or 2 weeks. Then from there, they go back to work on their tablets, thyroxine.
Right. So what advice would you give to anyone that is watching right now that may suspect that they have a thyroid disease?
So thyroid disease, most people see it as scary, but as I've said, it's not that scary. Don't be afraid. Come to hospital. The expertise is there. At the bank or hospital, as I say, we have a lot of equipment. We have all the gadgets we need. So come, we'll take you through. We are very friendly, very friendly nurses and doctors. We'll take care of you. We'll take you through the process, and you will not regret coming.
In the case of malignant versus benign tumors or growths in the thyroid area, is the approach different?
So yes, benign tumors as opposed to malignant tumors, you are interested in just the tumor and what it does to the rest of the body. So when we go and remove it, then it's okay. For malignant tumors or cancers, then you want to make sure the tumor has not spread locally. It's not spread to other structures around. And then we want to make sure it's not spread to other parts of the body as well. So we do further tests to determine this. We may do MRI, for example, to assess the gland locally around the neck, make sure the lymph nodes around the neck are not involved. Or if they are involved, then it means that in surgery, you are going to remove all these lymph nodes. So the surgery is a bigger surgery. It needs more. You may have 2 or more surgeons doing this surgery, because you may involve the ENT surgeon as well, especially in dissecting the neck and removing all these lymph nodes. So the surgery is a bit different. Post-op care also, because it's a bigger surgery, we need more attention for the patient. And then further on, the patient will be put on medication, cancer medication, to control the cancer, preventing it from spreading to other parts of the body.
Right. So you've been talking about the bank hospital. What else? Like, what other services do you
yes,
give?
So the bank hospital is a private hospital in Ghana, owned by the Bank of Ghana. Is the only currently accredited, internationally accredited private hospital in Ghana. And so everything we do are tailored to international standards. We have all the, as I said, facilities we need to take care of our patients. Our mother organization, the bank hospital, takes very good care of us, and so we have everything we need. The specialists, every specialist you can think of is available. Most of us are full-time, but they are sessional specialists as well. We can call in when the need arises. So we have everything we need to take care of our patients, so we encourage them to come.
Where are you located?
Yes, we are located at cantonments near NAFTI, the National Television Institute and Film Institute. We are not far from there, on the Shippy Road in
What's
cantonments.
the easiest way for people to reach you?
So there are various ways. The best way we like is to drive in, see the facility for yourself. But we have I have some phone numbers here.
Please go ahead.
People can reach us through 030-2739-373 or 025-799-5409. 025-799-5409 and 030-2739-373.
All right.
Or visit info@thebankhospital.com.
Right. Thank you so much, sir. It's been nice talking to you. So, ladies and gentlemen, we'll be speaking to Dr. Solomon Brookman. He's a resident general surgeon at the Bank Hospital, and we've been talking about the thyroid. If you've not checked your thyroid, if you feel like you actually have probably maybe everything that we discussed, it actually hits you, all you need to do is go to the hospital and check yourself, and don't be scared because there's a solution for everything. All right, let's take a quick break. And
sorry, before I go, I would like to say we are open to the general public.
Yes.
Okay.
And I would like to say hello to my CEO, Andrew Proven. He's been winning awards for us.
Okay.
The medical director, Dr. Charlotte Osafo, very hardworking, and the whole Bank Hospital team for the good work they are doing.
All right.
Thank you very much.
Thank you so much. And there you have it. A whole shout out to the whole bank.
entire team.
Yeah, the whole team.